Well, is the bottom line really the bottom line for whether a national health care plan will be approved?
Here to discuss that is physician and GOP Congressman Phil Gingrey. He is, of course, talking to constituents about health care in town hall meetings. Welcome, Congressman. We appreciate you coming on Fox Business.
Thank you very much. Glad to be with you.
Of course. What are you hearing from your constituents now?
Well, I've got a series of town hall meetings starting later on this week. I think I have about 6 in my district. But I was at a renal dialysis clinic this afternoon talking with them about concerns about coverage for end-stage renal disease, and to make sure with all these Medicare cuts, something like $500 billion cut out of the Medicare program, would those patients on this life-sustaining dialysis treatment, would they be able to continue to get that? So there's a lot of concern out there. You're seeing at these town hall meetings that the Democrats are having, especially across the country, and I'm sure I'll hear some of the same concerns when I start my town hall meetings.
You know, sir, it almost feels like there's a blowtorch of opposition going on out of the town hall meetings. We understand that. We know, we've heard the citizens' concerns, but the danger here is that the echo chamber in the media and what's out there becomes a message instead of what really needs to be done to reform health care. What are you hearing from the constituents on how they think it should be reformed?
Well, again, that's a great point. I mean, it's not that it's the public option or nothing, like my good friend Senator Tom Coburn, Dr. Tom Coburn in the Senate said. It's the public option or an option that the public can accept. And that's what they're asking for. That's what you're hearing. They don't want government taking over our health care system. They don't want socialized medicine. They don't want a bureaucrat in the exam room between them and their doctor. They surely they'll have some concerns over maybe insurance rescissions and denial of coverage for pre-existing conditions and that sort of thing. We can solve that without spending $1.5 trillion and adding to the deficit. You know, the deficit for this year is going to be $1.8 trillion, and we're going to add another $1.5 trillion over the next 10 years to that. That's not sustainable, and it makes no sense.
Of course not. But you as a surgeon,
Medicare,
you as a doctor, if I
yes.
could just interrupt, because your opinion is
Absolutely.
very valuable. You've got that added important aspect about what's going on in your view. What should be done without sort of alienating people who are actually happy with their health care benefits that they have right now, yet including some of the people who deserve to be included but don't really have health insurance?
Well, of course, and we're talking about 4.5% of our 300 million population that do not have health insurance. So the idea of cutting Medicare 10% a year over the next 10 years to provide that coverage really is counterintuitive. I think that people clearly want to make sure that people with pre-existing conditions have coverage. We can do that with high-risk pools. We can equalize the tax treatment. We certainly, as President Obama said to the AMA at their annual convention in Chicago, we should have tort reform. There's nothing in the bill that addresses that. You know, again, electronic medical records, equalization of the tax treatment. There are a number of things that can be done that would solve this problem for far less, maybe even save money. It makes no sense to go in this direction.
Representative Phil Gingrey, we really appreciate you, sir. Good luck to you, and we welcome you back on the show anytime. Thank you, sir.
Well, thank you for giving me the opportunity. And look, I'm for the American people. They deserve the right to speak out. And this business of dissing them and saying they're a bunch of right-wing extremists, when some of them are moderate Democrats and they're you know, people that are really concerned and they need answers from politicians.
All right. Thank you very much. The administration continues to insist